Okay, good morning. So the today's topic which we are going to discuss about is prevention, and basically the concepts of prevention, or the also called as the various levels of prevention. It will be a 5 mark question for the undergraduates, and even it can be clubbed with the either the dental caries, periodontal disease, or oral cancer etiology, epidemiology, and prevention. So likewise, they can be also asked as an essay. So basically, it is a very important topic. Also, it is very much related with our subject, that is public dentistry. So, what are the various levels of prevention? Before that, what is the goal of prevention? So, prevention is to promote health, to preserve health, to restore health, and when it is going to be impaired in any situations, it is we have to restore the health and also to minimize the suffering and the distress caused due to the various diseases. So the concept is like three important things, that is, one is to promote and another one is to preserve, and if there is going to be any impairment or any sufferings or distress is going to happen, we are going to restore the health again. So this is the goal of prevention. So what are the various levels of prevention? That is primary prevention, secondary prevention, and tertiary prevention. So what is prevention? So the definition of primary prevention can be defined as the action taken prior to the onset of the disease. So action taken prior to the onset of the disease, so that which removes the possibility that the disease will ever occur. So say for example, we are going to prevent DC, means what you have to do. We are going to brush your teeth properly, and we are going to stay away from the carcinogenic foods like chocolates, pastries, which are having a refined sugar or refined carbohydrates. You are going to prevent it. And what are the various mode of intervention through which the primary prevention can be achieved, or health promotion and specific protection. The first one is primary prevention. Coming to the next one, that is secondary prevention. Secondary prevention can be defined as the action which halts the progress of a disease at its incipient stage and prevents the complications. So, what is secondary prevention? Action which halts the progress of the disease. Actually, in primary, you could have seen, so that action which has been taken prior to the onset of the disease, but here already the disease has occurred. So now we are going to halt the disease at its incipient stage, or the early stage itself. We are going to find it out, and we are going to halt the progression of the particular disease, and also to prevent the further complications. Likewise, if you are going to diagnose a DC, means what you are going to do? You are going to fill it up with like a class 1 or a class 2, so that what is going to happen in the further, if it is not going to be prevented at that stage itself, it is going to provide the complications, like either you should go for a root canal treatment, or a grossly decayed teeth will become go for a indicator for a extraction. So which is going to halt the progress of the disease at its incipient stage. So this is secondary prevention. Coming to the last one, tertiary prevention. So again, if we are not seeing even during a progression of the disease, and when the disease process has advanced beyond its early stages, so it is still possible to accomplish the prevention by what might be called as the tertiary prevention. So what are the various measures? Likewise, that is all measures available to reduce or limit the impairments and disabilities, minimize the sufferings caused by the existing departures from good health, and to promote the patient adjustment to irremediable conditions. So what are the various measures? It may be a rehabilitative procedures. Say for example, again the DC has happened and it has progressed to either before extraction, you can even save the teeth by doing a root canal treatment. So it's one of the measures to reduce the impairment or the limit the impairment. And if at all it is a gross dedicated and it is no other go, it has been removed up now. And how you are going to restore the health? As I have previously said, the goals of prevention. we are going to restore the health. So we are going to provide a rehabilitation procedures. This also includes under tertiary prevention. So what are the major levels of prevention is primary, secondary and tertiary. There is another newer concept that is called as primordial prevention. Actually, the primary prevention in its purest stage is called as the primordial prevention, where what it is going to be done is, even there will be a prevention of the emergence or the development of the risk factors in the country or the population groups in which they have not even appeared. So you are going to the prevention of the emergence of the risk factors or the development of the risk factors. There itself you are going to prevent. So the main, what is going to be the main intervention for this type of prevention is individual or the mass education. So say for example, efforts which are directed towards discouraging children from adopting harmful lifestyles, that is primordial prevention, so that in future it may not lead to either obesity or hypertension. So good habits can be inculcated at the earliest stage, or the risk factors can be prevented at the very earliest stage, that is primordial prevention. So the primary prevention in its purest sense. So, coming to the various modes of intervention under which the levels of concepts of prevention can be done is, one is health promotion and specific protection, which is for primary prevention, early diagnosis and adequate treatment or the prompt treatment, that is for secondary prevention, disability limitation and rehabilitation, which is for tertiary prevention. What is health promotion? So the process of enabling people to increase the control over and to improve the health. So this is health promotion. Actually, it is not directly against any disease, a particular disease, but to strengthen the host against the disease through various interventions, like we are going to give a health education, how you are going to prevent the various diseases which are going to happen, and what are the various environmental modifications, what are the various dietary or the nutritional interventions or modifications, what are the various lifestyle and behavioral changes which can be inculcated. So these are the various interventions through which health promotion can be done under primary prevention. So coming to the next one, that is protection. Actually, you would have done topical fluorides or patent fisher sealants in our department, public health dentistry department. So this comes under specific protection. So the provision of conditions for the normal mental and physical functioning of the human being is under specific protection, which will be through the prevention of the sickness and the curative or restorative medicine in all aspects. Excuse me. So, as I said, the examples will be fluorides or the topic fluorides on the patent fisher sealants for caries prevention. There may be another thing like immunization, chemoprophylaxis, protection against the accidents, protection from allergens, the control various pollution control measures, and various food and drugs controlling various consumer products which are related to the foods and drugs. Everything comes under specific protection of primary prevention. So, coming to the secondary prevention, as I have already told, prevention is early diagnosis and adequate treatment. So, yeah, the earlier disease, if it is going to be diagnosed and treated, not the better it is from the point of view is the prognosis will be a better one, and also it can prevent the further complications or a long-term disability. So, it is say for example, if the cancer, say for example the cancer, if it is going to be diagnosed very early and you can provide adequate treatment so that the future complications can be prevented. So this is with regard to secondary prevention. So the what are the various important advantages is important in reducing the high mortality and morbidity of certain diseases like hypertension, but maybe a slight is little expensive. So say for example, if you are going to for a restorative procedures like giving a composite restoration or glass ionism, it will going to cost you. So little expensive than when compared with that of a primary prevention. So the coming to the last one, that is tertiary prevention. So it is going to be in the late pathogenesis phase. So we say that primary prevention, it is going to be in the pre-pathogenesis. In tertiary prevention, it is going to be in the late pathogenesis phase. So this is how it goes, the disability, that is disease, which will be leading to the impairment, which will be leading to disability, and finally it is going to handicap. So what are the various modes of intervention is disability limitation. So we are going to do a root canal treatment before extraction of the teeth. It is a disability limitation. And what are the various rehabilitative measures? That is the combined and the coordinated use of medical, occasional, social and educational measures for training and retaining the individual to the highest possible level of functional ability. So this is with regard to rehabilitation. There are various rehabilitation procedures like medical, occasional, social and psychological rehabilitation, through which, say for example, we are going to provide dentures for those who have already extracted their teeth. So this is tertiary prevention. So these are the three various levels of prevention which is going to happen. So thank you.